Greetings. Let us learn about eosinophilic esophagitis. So there are a number of different reasons for difficulty swallowing or dysphagia, and we talked about it in the previous sessions. And when it comes to the reasons for dysphagia, when the food gets into the esophagus and is having trouble going down, one of the reasons is eosinophilic esophagitis. In order to find out more, let us review this young gentleman's story who is waiting for his endoscopy. He is 25 years of age. He has suffered with allergies all his life and also asthma. And he started having difficulty swallowing food for the last few months. He reports having had choking spells and one episode of a chicken sandwich getting stuck in the esophagus that required an emergency room visit and endoscopic removal in the emergency room. So this is a classic story of a patient with eosinophilic esophagitis. When you take him up for endoscopy, this is what you see. The esophagus lumen is a little bit narrower, and you see rings, circular rings, as well as longitudinal necklace type grooves that are the hallmarks of eosinophilic esophagitis. And when you see this, you want to confirm the diagnosis of eosinophilic esophagitis by taking biopsies. And one needs to take biopsies from the lower end of the esophagus, put it in a separate jar, and upper end of the esophagus and put it in a separate jar. When the pathologist looks at the pieces, he will make a diagnosis based on the number of eosinophils in the mucosa. In addition to making the diagnosis, if you want to help the patient with improving his swallowing, there are a couple of things. One could consider giving medication like omeprazole or Prilosec to cut down the acid. In some, that helps. In others, they may need a steroid swallow to cut down the inflammation. It's similar to the steroid inhalers that asthma patients take. Instead of inhaling, they swallow the puff of steroid inhalation. And you could also help them by doing dilation using either a bougie or a balloon. Unlike other dilations like Schatzki's ring or esophageal web, when you deal with eosinophilic esophagitis patients, you should start with the smallest dilator and go slowly. That is the most important thing. And these patients could have a lot of chest pain after dilation because they tend to tear easily. And we will talk about how to do these dilations in another session. And I want to thank the support from Dr. John Stroline, Mr. Charles Butt, and illustrator Angela Deal. Thank you.